I love birth plans as a midwife, and when do you start discussing them with your community midwife? Hi, I'm Angie. For anyone I haven't met yet, I'm at the Eco Midwife on social media and I've been a practicing midwife for the last 13 years. Birth plans, birth preferences, birth choices, whatever you want to call it. Having that antenatal education, ideally before 34 to 36 weeks, enables you to be able to go in at your 34, 36 week appointment with your community midwife and have those discussions about what your choices and your options might be. And the reason it's usually done around about 36 weeks is to confirm that your baby's in a head down position, that everything in your pregnancy so far has been okay. And if there has been any additional complications, it provides a lot more detail and depth, maybe from scans, for example, to be able to have those conversations about what your birth choices and your birth preferences might be. Now, I do want to caveat that though. You can talk about your birth preferences at any point in your pregnancy with your community midwife. So at any point you have a question that comes up that you think, oh, would I be able to have that? Am I eligible for that? Would this normally be supported? You can have that conversation with a community midwife then, because if you are considering out of guideline, out of hospital guidance birth, then what you're going to want to do is be able to discuss with your midwife a potential referral into a personalised birth clinic, into a consultant midwife clinic, for example, so that way you're having these discussions ahead of time. And an example of this might be that you've had a previous caesarean birth and you might be considering a home birth, for example, or alternatively a birth centre birth, or not having continuous monitoring during your labour and birth, which is normally recommended for people who have had a previous caesarean birth. Check out the VBAC series for the evidence and information about that and previous posts that I've done on Instagram. And these personalised care plans will go through a lot of different options depending on what might arise in labour and birth. What it means is that you'll be less likely to be coerced, less likely to feel badgered about having certain things that might appear. You'll also know where the midwives will have to recommend certain stuff as well. So for example, in that personalised care plan, they will listen to your thoughts, your feelings, what you're coming in with, what you really want, for example. And then what will be able to happen is a discussion of, okay, so we've talked about plan A happening, everything's going really smoothly, everything's lovely, hunky-dory well. What if, just for example, your baby poos inside you? Our normal recommendations for your baby pooing inside you is A, B, C. Would you accept A, B or C? And what if your baby's not moving on that day? What if you have bleeding or scar pain, for example? Where are the thresholds? The midwives will have to advise based on their own guidance on this, and we are telling you ahead of time that that is the normal process, the normal protocol, the normal advice, so that you are not blindsided at the time. But it also enables you to have those discussions and go, okay, yeah, if this happened, this is what I would accept. This is the level of intervention I would accept. This is my plan B, my plan C. And if plan C became evident that intervention was needed, this is what I would like it to look like. This is what I would like it to happen. And this will help me have a much more positive birth experience. And at that birth preference discussion with your community midwife, they will want to know certain things. They want to know what pain relief choices you have considered, where you might be considering to have your baby, anything that you want in particular in relation to labour and birth, whether you want the injection for your placenta, and whether you would consent to vitamin K or not. And also, have you considered the different feeding choices and feeding options, and even thinking about antenatal hand expressing too? And birth plans and birth preferences do not guarantee you the perfect birth. And I hate the idea of the perfect birth even existing, quite honestly. But what it does is it gives you the ability to have these conversations about different options in the pregnancy period, different things that would be acceptable to you, things that you really would like out of your birth, things like skin to skin, for example, delay cord clamping. It gives you those options to really discuss, and lots of these things can be facilitated whether you have a straightforward vaginal birth at home, whether you're in a birth centre, whether you're in a hospital, whether you're having a caesarean birth. Lots of these choices can happen in the majority of births. And so having those discussions really enables you to be in the driving seat of your labour and birth. There is a great line by Holly de Cruz that really highlights that if you don't know your choices, then quite honestly, you don't have any choices. Choices are what I am such an advocate for as a midwife, because this is your labour, your pregnancy, your baby, your birth, and you should be in the driving seat of this. And most importantly, supported in your choices.